Robert Stiles.
And
I'm Robert Stiles. I work with the Heartland Telehealth Resource Center, which provides, as we were talking about, technical assistance related to telehealth to Missouri, Oklahoma, and Kansas. And it's funded by the feds, so everything we do is free. And one of the things I've been excited about over the last couple of years is our work with the Missouri School-Based Health Alliance and our working with their telehealth activities and being on some of their committees, and really enjoy working with them and are pleased to have them presenting today because I, before this, was the CEO of Central Ozarks Medical Center in the Ozarks and did a lot of school health and really believe in school health. And one of my other jobs here at KU is working with school health in Kansas. So Molly Tickner, who is the executive director of the Missouri School-Based Health Alliance, has over 25 years of combined experience with mental health, school systems, and social service, and started her career as a school-based mental health provider. So she's got on-the-ground experience, which is always helpful. She's going to be joined today by Michelle Nielsen, who is new program manager working with the Missouri School-Based Health Alliance. And she has a Bachelor of Science degree in Healthcare Administration and a Master's in Education, so great education experience as well, and has many years of experience working with nonprofit organizations, grant writing, project and program development, teaching, curriculum design, and partnership development. We're really pleased to have them today, and I'm going to hand off to Molly. And the only question I have, Molly, is would you like people to, if they have questions, to type them into the chat during and have me ask those, or do you want to wait till the end, whichever works better for you?
Yeah, I think if they would just type them in the chat, Rob, that would be great. And maybe if it's just a quick one and done, I don't mind answering it if it's relevant. Yeah, and then if it's something that we can address in the end, I think either whatever the group is comfortable with is great.
Sure, I'll monitor the chat, and if questions come up, I'll try to find a place between slides and ask you, and you can answer or put it off till the end, whichever works better. So please go ahead.
Sounds great. Well, thank you, everyone. And thank you, Rob, for that wonderful introduction. And Michelle and I are so excited to be part of the Missouri Rural Health Conference. Being virtual, it's always been a challenge this past few years, but we're excited to be able to talk a little bit about school-based health and the work of the Alliance. So we'll go ahead and just get rolling. So today, what we're going to be talking about is really just to define in the state of Missouri what we consider a school-based health program and the program models type, and talking a little bit about the efficacy of school-based health and how it improves health and education outcomes. Talk a little bit about the key concepts in planning a program and talking about program sustainability. That's an issue that as a statewide alliance, we are addressing to make sure that we're not only growing programs around the state, but we're providing the support and the funding streams and the technical assistance to those programs that are actually currently running. And then looking at how we, as the Alliance, and you as supporters in the healthcare world and education world, depending who's joining us today, can support the school community and how you can support school-based health growth in Missouri. So again, like Rob said, if you have any questions, please go ahead and put them in the chat or raise your hand, and we'll address them either throughout or save them to the end. So just a little bit about the Show Me School-Based Health Alliance of Missouri. It's a long name. We call ourselves MOSBA as a little acronym. We support communities in building and sustaining school-based health programs because we, much like your similar organizations, we really truly believe that every child and youth in Missouri should have equitable access to quality healthcare. And we know based on decades of research that school-based health is a way to provide that much needed healthcare support. Some of the things that we really offer, we are a very small organization. Right now, it's just Michelle and I. It's a small team of two. But we really we have a pretty good history. The Alliance, although we are new, we are incorporated in 2018. We were built off the work that was happening based on the Ferguson report, as well as work from Washington University, who are looking at how can we better serve the health inequities, specifically in the St. Louis area. And based on the research that they were doing within the Brown School, they found school-based health. And so they actually were key to starting some of the first school-based health centers in the St. Louis region, the spot at Jennings and a few other ones in that area. Meanwhile, there was some work happening across the other side of the state with the Missouri School Boards Association, who is convening education stakeholders and state organizations on how to address the growing healthcare needs, specifically mental health needs of students. And lo and behold, they learned what was happening over on the east side of the state and found school-based health as that model. So we linked with the National School-Based Health Alliance, and subsequently we became the state affiliate of the National School-Based Health Alliance, and subsequently hired staff to be able to support our founding board members and develop committees to be able to provide not only resources, but best practices of school-based health. We have a pretty robust advocacy and coalition building platform. We advocate at the local, the state, and the federal level as we look at policies and legislation that are coming down the pike that will impact school-based health programs, whether it be through education or the healthcare side. We also provide a pretty robust training and education. We do that through, prior to the pandemic, we were doing quite a bit of traveling and doing in-person trainings. We obviously have shifted to more of a virtual platform now, but we are available to provide one-on-one technical assistance to a school and or a healthcare provider who's interested in school-based health in that planning stage, as well as providing that training, education, and technical assistance to those that are currently implementing or wanting to grow into and expand their program, as well as how to sustain a program. So through all of the stages of school-based health. One of the things that we really tried to build up in the past year is building up a peer-to-peer network. We are a small organization, and we know that there's amazing things happening across the state in our school-based health programs, and we want to learn from each other. And so we've tried to create a platform for school-based health providers and educators that are in that realm to network with each other and share resources and create communities of practices where they can talk about challenges related to the planning or related to their programming or funding. So that's something that we've really tried to boost up in the past year, especially since we are all virtual. Very important. So we have expanded the definition of school-based health in the state of Missouri, but what we do use the definition from the National School-Based Health Alliance, where it is a shared commitment between a school, indoor district, and a healthcare organization to truly support the holistic needs of that student, their physical health, their mental health, their vision, and their dental, as well as not only just the students, but our school-based health providers. You'll see in some of our data that we've collected in our census that we'll review in a little bit. Our school-based health programs also provide services to staff and the staff and the school staff and potentially their families, as well as some are opened up to the community. It really just depends on what are the needs of that community and how that partnership works between the healthcare organization and the school. So it truly is this partnership to really make sure that they're providing preventative as well as treatment services for students at the school or near the school. So we know, I'm preaching to the choir here, but we know that in order to be healthy, we have to be in school, right? We want to be in school and we want to be healthy. And so we know that quality school-based health programs are a way to improve health outcomes as well as education, as well as it's an equitable way to make sure that all of our youth and our communities have access to healthcare. So we really, truly are built on making sure that we have equitable access to those resources and those supports. And again, I talked a little bit about the history, but this is just an overview of some of the work that was done to create the Alliance and all of the continued support that we have in the research around school-based health, which we'll talk about in a little bit. So we know that's an evidence-based model. This is the why. We know that school-based health, based on decades of research and in our partners in other states that have been doing this a lot longer than we have, and even partners, our healthcare partners that are currently delivering school-based health that have been doing it longer than the Alliance has even been in existence. But it increases access to care, which decreases health disparities. We know that having preventative services like well child visits and access to immunizations and access to a clinician, whether it be for physical health or mental health or vision or dental, reduces hospitalizations and limits the amount of visits that our families traditionally to go to the ER if they don't have access to that primary care or that resource. It's also very adaptable and sustainable. There's not one way to do it. That's the one lesson learned that we hear from a lot of our school-based health programs and our schools because it looks differently based on the community needs, based on what's happening in the school, based on the healthcare provider and what services they provide and what that partnership looks like. And again, we know that it improves health outcomes. It also increases better coordination of care. It helps. One of the things that we know, and like I said, we have some, I know that I've seen some familiar names on our call today that have been in school-based health, but it also helps provide a more, what we want to call more of a healthcare home, right? Because we have, if you are a school-based health provider, you're also linking potentially that student and or that family with resources in the community with ongoing care outside of that school-based health program, like providing community needs and addressing some of the social determinants of health, as well as providing health education. So it definitely leads to improved health, not just for the student, but potentially for the family. It also leads to improved education outcomes. We know over time that it improves academics because the kids are in the seats. And when they're healthy, they can learn both mind, body, and spirit. We know it improves attendance. And I'll say that this is not just for students, but also for staff, because when your students are not healthy and your staff are not healthy, you potentially have more people calling in, your teachers and your educators, or if they're burnt out or feeling like they're not mentally well and they're not supported, they might not show up. So we know that access to this service in the school definitely helps with that, as well as it increases engagement. It helps people feel connected and feeling like they're part of that process. Because what we know about our school-based health programs that are successful is they're not just coming in and seeing kids and leaving. They are truly part of that school community. Those clinicians and those providers are talking with the school nurses and coordinating with the school counselors and talking with leadership, attending wellness fairs, and really being involved in the community, in the school community. So it definitely creates that feeling of school engagement and gives people a safe place to seek treatment. Looking a little bit about the school health landscape. So we did a pretty extensive census of school-based health. It's the first ever statewide school-based health census, and we completed that 2019, 2020 before the pandemic. So we know that there's been some differences in some of the data that we're currently need to look at, but we looked at who sponsors programs in the state of Missouri. And there are multiple different types of, like I said, there's not one way to do it. We know that there's community health centers that are the healthcare sponsor. We have hospital systems. We even have foundations, behavioral health organizations, some nonprofit organizations that sponsor, as well as there are some districts in our state that provide their own healthcare services. They actually staff the primary care, the RN, or they staff the mental health professional. And so there's multiple, it really determines what access point you have, what healthcare providers are there, and what works best for that school district. And so that's how we can help kind of, if you are interested in getting into a school, if you are a healthcare provider or the other way around, we can help kind of figure out, okay, so what providers are already in that area and what services they're already providing. Are they already doing school-based health? Are they even interested in growing and expanding? So that's something that we can definitely help explore. So this is something that I like to talk about because it's top on everybody's mind, whether you're a school administrator, a board member, or on the healthcare side. How do we fund this? How do we fund starting it up? How do we determine what type of program works for us? And how do we finance it in the long term? Unfortunately, the state of Missouri is one of the many states who does not have a state line item budget for school-based health specifically. So our school-based health providers, our federally qualified health centers, which are much like some of you on the call, they have access to funding at the federal and or state level to help support school-based health, and they could get reimbursed through insurance. But the most sustainable model that we know when we look at the national data of school-based health is having a line item budget out of our governor's budget to say, hey, this money goes and is allocated to help the growth and sustainability of school-based health. So that's one of our key priority areas and our policy areas that we're working on right now. We just convened a state ad hoc council, which is made up of all of our 4 state agencies, as well as some of our MCOs or managed care organizations and a few stakeholders on the education and healthcare side to look at how do we help advocate at the state level to provide school-based health funding. And working with our Department of Health and Senior Services and DESE and DMH to really help build that. Because currently, right now, most of the funding that's coming to support school-based health is from grants, federal grants, local grants, small philanthropic organizations. There is a level of reimbursement, like I said, for insurance to help maintain some of that, but really currently it is organizational funding and some fundraising and some tax levies. There are a few communities like St. Louis and in Jackson County on the west side of the state and in Springfield that had passed tax levies and children's funds to support school-based health efforts, and that community has chosen to use it to support school-based health. So looking at the data, so when we did our census, we were pleasantly surprised about the growth of school-based health programs that we've seen. I just recently looked at kind of the history of the Alliance when the work group just started in 2014, and we had very limited amounts of school-based health programs. And now we're happy to say that we have a bunch of school-based health programs. As you can see, we have over 675 school-based health programs in the state of Missouri. This is where the definition that we found was in the state of Missouri, where we expanded it. So the National School-Based Health Alliance has 4 types of programs. One being telehealth, the other one being your traditional school-based health center, which is that all-inclusive brick and mortar model where you're getting physical health, a level of mental health and or a vision and oral. That's a pretty limited model in the state of Missouri. They are growing, but it just depends on the capacity of that school and that healthcare provider to actually have a brick and mortar space. The mobile program and a school-linked healthcare program. So those are the 4. We've expanded that in the state of Missouri because when we did our census back starting in 2019, we realized there was many different types of school-based health programs, and we wanted to make sure that we were acknowledging the successes and the great work that our healthcare providers in our schools are providing to meet the healthcare needs of their communities. It's not surprising that when we did this, we found 522 programs that are specifically providing mental health services in the schools. So there might be other levels, other services being provided, but we do have providers that are just providing mental health services in the schools, and that makes up 522 programs. Telehealth, I've Robert's on the call, and I was listening to a couple of the breakout sessions earlier. That's an expanding model, mainly because of our virtual world that we're now living in, and we at the federal and the state level, there's a higher level, the ability to bill telehealth services. So we've seen that expanding, and I will say that these numbers are pre-COVID. We do know that there has been some growth in school-based health, so we're updating our directory on a weekly, if not daily basis. So we know there's been some growth. Mobile programs are made up of not only you see the vans or the buses that are parked outside, but also we include mobile programs as those clinicians that go from school to school or from district to district. So they might share a space with the school counselor or the school nurse and provide that care. We do have 2 programs that we know of that provide school-based oral health that actually have like dental offices in their schools, which is pretty cool. And they do some preventative plus restorative care. So again, there's quite a makeup, and it continues to grow. Looking at who is part of those sponsors, so who are those healthcare providers? The most common type, and this is a national statistic as well, that provides school-based health services are federally qualified health centers. And for those of you who are not familiar with the FQHC, most of you probably are since you're part of this conference, but the reason why they are the most common healthcare sponsor for school-based health is they do get a higher level of reimbursement. So they have a little bit more funding coming in from the federal government to be able to provide those services. We do have a small percentage of nonprofits and community health centers, as well as hospital systems that sponsor and other community-based organizations. This is just a brief breakdown. Again, you'll probably get these slides so you can kind of dive deeper into the data. I'm happy to answer any questions or send you guys information as we dive deeper into our census data. But I wanted to let you know that as of when we took this information, we found that over 520,000 of our students have access to at least one type of school-based health program. That makes up about 40-ish% of our students. So we do have a lot of work we need to do. And I'll caveat it here that when we collected this data, we took data from DESE as well as some other state and local websites or sites. So it does not necessarily include all of our private schools. There isn't one way currently in the state of Missouri where we can access our private school information to know how many have. So this is mainly public schools and charter schools, with a few private schools that we know of that have reported information. So the schools involved in that are a little bit over 1,200 schools, which makes up about 256 districts in 79 counties. We know there are gaps. Our next step in this census data, now that we've collected it, is to really look at those areas that don't have school-based health programs and dive deep into those areas. You can see red represents the counties that have at least one school-based health program. So even if there is, let's just say in Jackson County, we know we have some mental health programs, we know we have school-based health centers, but there are probably areas in Jackson County that don't have access to a school-based health. So it's not just the counties that are gray that don't have anything. So we definitely want to make sure that we're prioritizing, and that's our next step, is to look at the areas that don't have access. Are there healthcare providers, much like you all, like FQHCs and community health and hospital systems that can support that, or are providing school-based health services somewhere else that we're willing to grow? We know that a lot of the areas in gray, we also had a lot of rural hospital closures. So this is an area that not only is a lack of school-based health, but there's a lack of healthcare services in general. So right now we're working on creating a needs index to look at what are some of those key metrics that we can collect and data we can collect to determine how can we help better support and how can we prioritize some of these communities to give them access to school-based health. One of the things that surprised me when we looked at the data is, our school-based health providers, like I said, they're not just providing that direct healthcare services. 86% of our providers, per our census data, are providing at least one other supplement support, including staff training, health education, going into classrooms, providing parent support, providing youth development programming, creating like student advisory councils, providing some nutrition support with with the school nurses. And so they're embedded into the schools. The one thing here that we found is that they do this because of the best practice, but most of the services they're providing here, these supplemental services, are not currently funded. So that's another policy priority that we have, that we're working with our state organizations and some of our managed care companies. Is there a way that some of our healthcare providers can get some sort of stipend or get reimbursed for some of these supplemental services that are so important when we're talking about the holistic care of our youth and our school community? We do base, like I said, how we help support our school-based health programs on the core competencies that were created out of the National School-Based Health Alliance. I'm not going to go into all of these, but because this is talking more about planning. But these are the areas. System coordination, it takes a village, right? Like creating a school-based health program isn't just the school and the healthcare provider, right? We need to engage our local communities, our local chapters, our primary care physicians that are in the area, because ultimately, yes, we want the students to use a school-based health program, but we also want to engage the outside providers that are meeting other needs of the families. And so looking at access, making sure it's student and parent focused. So asking for student voice is really important. Integrating into the school, looking at financial sustainability and overall school wellness. So today we're going to focus primarily on creating that strong partnership and what it takes to plan. So why are strong partnerships so important? And this goes beyond just school-based health. I mean, the more we talk about this, the more I think about any partnership you have, you really need to have credibility. You need to make sure you're looking at connections, expanding your knowledge and experience, and looking at coordination of care, quality of care, And ultimately, the more that you have that strong partnership and the more you're communicating with each other and you have these characteristics, what we're really looking at is that bottom line. It manages risk and liability because everything is up front, right? You're really focusing on building that relationship so that everyone can be transparent. One thing about school-based health, if you're not familiar, is, our healthcare organizations and our education systems really speak totally different languages, especially when you're talking to administrators. So making sure that you're very clear about what are the requirements on the healthcare side, what are the requirements on the education side, so that everyone knows roles, responsibilities. And we have a shared vision for student success. We look at our outcomes and our common goals, and we talk about them before, right? The picture that you're seeing on your screen right now is Belton School District 3 years ago opened up their school-based health center with Centerpoint Hospital System. It started as a physical preventative care and acute care, and they recently started to added mental health services, and they have some dental support as well. And when I was talking with the superintendent there and the medical director of Centerpoint, they planned this for 3 years. They engaged their Chamber of Commerce, they engaged their community, they did surveys with parents and their staff about what is the priority, what are the needs, which is kind of what that's one thing that we can help out, is looking at that needs assessment. So how do I know if mental health is more of a priority or where do I start? And so they started this process and looking at potential funding and interviewing partners 3 years before they actually had their ribbon cutting ceremony and they opened it up, because they wanted to make sure that policies and procedures and structures were not only integrated, but also meeting the needs of both of the communities, as well as making sure that staff are being part of the school environment, involved in the whole process. One of the key stakeholders that we often leave out, I worked at Kansas City Public Schools and I supervised the nurses and all the mental health staff and the healthcare staff. And I'd be in leadership meetings and they'd be talking about healthcare policies and practices, but the nurses weren't at the table. My director of nursing wasn't at the table. And I think that's another key area about that partnership, is we need to make sure that it's not only the healthcare staff, but they're really truly coordinating with, whether it be the school nurse, the school counselor, or someone that's in that direct care role. Which is why it's so important, like I said, with Belton School District as an example. It is a best practice to put an RFP. Most school districts, as they're exploring any partnership, it's a requirement for them to put out a request for proposal. Even if they're not paying for the service, most districts don't pay for the school-based health program. That's kind of the partnership arrangement. There is some cost, obviously, to that buildup. That's one of the biggest barriers to starting a school-based health program, especially if it's going to be a brick and mortar on site, are the capital expenses of building up that program. Making sure the space is what it needs to be based on the requirements of the healthcare facility, as well as making sure that you have the right equipment. And so there is quite a cost for that. I think a study came out in about 2016 from the National School-Based Health Alliance that for a full-blown school-based health center, that the startup cost can reach, if they're starting from scratch, like there's no space, it needs to be completely built out, is somewhere between $60,000 and $80,000. So that is why we at the state level and the federal level are looking at how can we help support our healthcare providers in our schools by providing some level of funding specifically to help cover some of those operational costs. So in looking at the RFP development, this is where it is the opportunity of the school district, and or if you're a healthcare provider and you're trying to figure out what school to go into, either way, this is really the who, what, when, where. Who will they serve? What are going to be the hours? What are your expectations? What's the financial sustainability plan? What's the evaluation plan? How are we going to make sure that our program is successful and it's meeting the needs of not only the healthcare organization, but the school as we report to our respective boards and our stakeholders? Looking at a timeline, what other partners need to be part of the process? So those are just some key considerations as we look at that RFP process as you roll that out. We do have, like I said, a wealth of resources, and some of the resources we have are sample RFPs, as well as memorandums of understanding. This is another key area. We've done training specifically just on creating MOUs, where we want to make sure that this is an opportunity that once you do select a partner, whether it's an education partner or the healthcare partner, that it is clearly defined what those roles and responsibilities are. Being transparent about what is expected of each partner and who's going to do what, and clearly outlining the roles. That is what's going to make your school-based health program the most successful, is to make sure that that school nurse knows exactly what her or his role is, that that school counselor knows exactly their role, that the healthcare provider that's providing that direct care service, whether it be a nurse practitioner, a physician, or an RN, knows exactly what they're doing, or the qualified mental health professional. It definitely creates less angst as you roll down the road. You can't predict everything, but it definitely creates a mutual respect and creates some more clarity on how we can all work together and meet the needs of that school community. I'm not going to go over all of these, but this is really just, we took one of our MOUs that we drafted, that we actually took from a National School-Based Health Alliance, and we put in all of the different type things that need to be considered when you're developing an MOU, which this really honestly goes even outside of school-based health. Some of these are specifically with healthcare in mind, especially the billing and the compensation, looking at, what are the responsibilities of all parties. I will give credit to the MSBA. Their legal team did help us define this as well, because they want to make sure that the school districts are protected in terms of liability. How is security going to be handled? How are the students and the staff, or if you're serving the community, going to flow in and out of that clinic, if it is a clinic, or if it's a mobile program, what's the space going to look like? If it's a telehealth program, who's providing the technology and who's providing all the equipment, and how is that going to be sorted out? And so really, this is an opportunity to put everything on paper to make sure that everyone truly understands, what this is going to look like and what the expectations are. Another area that has come up a lot, and I will say that as we have our communities of practice and people reach out to us, even after they've developed a partnership and after they've implemented and started a school-based health program, is that data sharing. And so one of the things that when I worked at the school district and we were engaging healthcare partners, schools share data, an insane amount of data, with the state, with the local, with funders, and so do healthcare organizations. And so how do we make sure that when we're developing this partnership in this MOU, that we're very, very, very clear on the healthcare side about who can access what data? And are the systems going to talk to each other? Are the EMRs going to be accessed by any of the school staff? Are the SIS systems, information systems on the education side, are they going to be able to be accessed by the healthcare side to check in students, to see where they're at, to look at schedules, and who needs access to that? What can the educators see in terms of what students are getting treatment and what treatment they're getting? And especially, this is extremely important as we think about if you're going to be seeing the education staff, like the teachers. How is information going to be stored? Who has access to that? So really being very, very clear. Again, we have some examples of data sharing agreements. If this is something you want to explore, please feel free to reach out. Our contact information will be at the end of this, and we'll share it in the chat if needed. But we just wanted to make sure that this is an area that we don't take lightly, because this also comes into play as you develop your evaluation down the road. What is the program evaluation? So where are we sharing that data? As we look at the students that potentially are accessing school-based health, and we want to monitor their health and education outcomes so that we can report to our school board, if I'm a school administrator, that, hey, I know that these X amount of students have been continuously cared for with our school-based health program, and now we've seen an increase in their attendance, a decrease in their behavioral incidents, or whatever that data is. So this is what can be clearly outlined in data sharing. Preaching to the choir here. I mean, it's no surprise that looking at communication and collaboration, being very transparent from the beginning, being very looking at how you as a healthcare provider can integrate into that school, how you collaborate with other healthcare providers in the area, or especially if you work maybe in a rural environment, you might not be the only healthcare provider, right? There might be a school-based health dental provider coming in that does the screening, and you're providing the preventative and acute physical health, and there might be a mental health provider. So really looking at that systems coordination so that we don't overwhelm our students and our families. Well, who's going to do what, and who's contacting the families, and who's coordinating, and who's working with the school, and who's that point of contact. Just some key tips to developing a communication plan, looking at what that referral process is going to look like. So how does the school-based health program access the students? So how are they referred? Are they referred by the teachers? Is there an online form? Are they referred by the school nurse and or school counselor if it's a mental health issue? Looking at the policies and the procedures and some emergent needs and some challenges. How are those processed? Are you meeting? We've heard some of our providers, I think some are even on the call, that they have weekly or quarterly meetings, like check-in meetings between the health organization and the school and or district to talk about what are some of the challenges, what are some of the emergent things that we're seeing an increase in flu, we've seen an increase in strep throat, some of these things, how can we brainstorm that just to make sure we're all on the same page? Some ways that we've heard from our providers, that tools that they've been able to use. This is especially important in the planning part. And this is a lesson learned from some of our programs where they started their program and then they're like, whoa, we're not really getting the volume that we thought. So how can we better market, right? How can we better get out there and communicate to not only the school staff, but the students and the families and the community that we're there, that we have this service. Some ways that they've done that is the healthcare providers have integrated into the website or the social media platforms of the school districts. They leverage, any events that the school district might be hosting, back to school fairs or health fairs or parent teacher conference days, any of those, any open houses they might have. They also look at potentially leveraging the school district's communication platform. So sometimes our schools have like robocalls that are sent out to the parents. So how can they integrate that into the healthcare organization? How can they integrate into that system? So there's different tools and tips. If you're communicating with the school district, they can probably help you figure out how can you get the word out, and whether that be through flyers or more of a virtual kind of platform. Talked a little bit about this already, but just some keys as we look at that collaboration. It's really important just to prioritize team and relationship. We heard when we were doing one-on-ones a couple of years ago that if there is not a good relationship between that healthcare provider and that school nurse and or school, that key referral team, if they don't have a good relationship, that's going to impact referrals. That's going to impact quality of care. That potentially might impact sustainability of the program. So really making sure that the direct care providers are communicating effectively, that they're collaborating, and they're really working on building that relationship because they're the ones that are going to make or break your program. And we want to make sure that they're all really truly getting along and meeting the needs of the students in the school. So we took this, and I have this visual and this graphic for you as well. It actually does link to the National School-Based Health Alliance, but here's some key things that our healthcare providers have done to be more integrated into the school community. Oftentimes, especially our mental health providers, they're part of a crisis response team. They're providing like suicide prevention. They provide support in intervention plans. They're part of health education curriculum development. So there's a lot of things that we all as healthcare providers can do to support our schools and even some of our teachers in terms of like, how can we help promote school wellness? Because, school-based health isn't just about that direct provider. It really is about that holistic healthcare wellness for the school. Looking a little bit about roles and responsibilities, we put this in because one of our biggest stakeholders and one of our key advocates of school-based health are actually school nurses. Typically, a school nurse and or a school counselor are the ones that become the champion of, hey, how do I get my school administrator or my board or my superintendent to be on board with school-based health? And we have many school nurses that are part of Alliance activities that provide trainings for us and be part of our panels. So this is really important just to kind of look at what are some of the things that a school-based health program can do versus what school nurses can do versus what they do together. So just some considerations. For time's sake, I'm going to kind of move forward. We only have a couple more slides and then we can open it up for questions. We'll provide some resources, and Robert, I'm not sure if that's something I can email you or I email Melissa. I do have a folder full of just some resources on planning a school-based health program and some of our census data. Some are embedded in here, but some we can provide and send out if people are asking for it. So
I'm going to send it to Van Dyne and she can make it available to all the participants.
Perfect. Okay. As we wanted to highlight something, schools are starting probably, I think, next week, if not some schools are even back this week. At least staff are back. But one of the things we looked at when COVID hit last March was how does school-based health programs support school reopening, especially given the pandemic. And now we're in an even more unique place because the majority of our schools, as you all know, are starting in person, whereas last year, I think we had more of a hybrid kind of model. So looking at closing the immunization gap, we know that now Missouri is in a place where many of our kids do not have the required immunizations to enter in school, and our school-based health programs can help with that. They've done vaccination clinics, not only for COVID vaccine, but also for the required vaccines. If approved, as you know, our healthcare organizations can do COVID testing and help with vaccinations. They've supported tracking with quarantining efforts, with tracking COVID cases, providing preventative and urgent care. And really, one of the things that we've seen a growth in is addressing those increased mental health and behavioral health needs of our kids, especially given the high anxiety rate we've seen in depression of kids when school closed. There's, helping establish policies with cleaning and sanitizing, and really helping potentially providing supplies to the schools they don't have access to. We took a few resources on looking at the immunization gap and flu vaccinations. We have some resources on kind of doing even a drive-through vaccination clinic. And maybe some of you all have done that already. There's also like a marketing campaign and some different things that we provided you all in terms of looking at how can we support that. One of the other things that we developed, this is actually, click on it and go, is a guidance for our school-based health programs during the pandemic. So this is something we created last year in the support of one of our committees and our school-based health providers, is what are the things that we can do. We created basically a checklist and a guidance document for school-based health providers, for school administrators, and for school nurses. So this will take you click on this link, it'll take you to this document and I can walk you through some of the things to consider as we reopen for school. A few links. So on our website, we did create last year, we created a school-based health online directory. So this link will take you directly to our website where you can see what healthcare providers are providing what school-based health services in what schools. And so that can kind of help you either figure out, okay, so who else is providing services in the schools that potentially I'm in or I want to be in, so you can create those partnerships and really build up the network. If you want to dive a little bit deeper into our census data, we did create 3 census briefs on access, who has access to what programs, as well as what programs are planning at that point, that snapshot point in time. We also created the link. We have some events coming up and some trainings. We also put all of our past trainings and listening learning sessions on our website for you to hear and access and look at the resources. So again, a wealth of resources. The National School-Based Health Alliance has amazing resources. And the one thing I love about being part of the School-Based Health Alliance, the national, is we steal shamelessly. Everybody, there is no reason to reinvent the wheel. If you have a question, we're here to help support you. And so is the National School-Based Health Alliance. So you'll have my contact information here, as well as Michelle, our program manager, who can help guide you, and our website. And we're trying to create more of a social media presence. Michelle's trying to get me more into the social media world. So hopefully you'll see us, and please like us on Facebook and Twitter, and we'll start to post more things coming up and what we have coming down the pipe. Thank you all. And just want to say thanks to all of our wonderful organizations that have provided us financial and in-kind support so that we can do events like this. So I'll open it up for questions.